Synovial joint is a diarthrosis. That means it is easily movable. The freedom of movements are more here in synovial joint. And the other peculiarity is that it has synovial cavity. So it is a cavity, a fluid-filled cavity. As this figure shows, there are two bones which are forming a joint, and here a joint is formed. In around the joint, there is a cavity, and that cavity is called a synovial cavity. And ends of the bones are covered by articular cartilage, as you can see here. And like other joints, these joints on the periphery, it is covered by fibrous capsule. So outside there's a fibrous capsule. This white colored structure is fibrous capsule. Inner aspect of the fibrous capsule. So what you're seeing here is the periphery, outer aspect, inner aspect. There you have a lining of synovial membrane. So this is synovial cavity. Inside the synovial cavity, so this is a fibrous capsule. So inside that there is lining of synovial membrane. So synovial membrane is a membrane which is going to produce a fluid called synovial fluid, and that synovial fluid is going to line the joints, or it is going to fill the synovial cavity. Synovial fluid is like white of an egg. How it looks, white of an egg. So it is something like that, synovial fluid. And if you look at the type of joint, the synovial joint, it can be seen in majority of the uh, body, right? Major joints, they are actually formed by, or most of the joints are formed by the synovial joints. Now how will it look like, a structure of a synovial joint? The articular surface, the articular surface of the bone, they are going to cover by articular cartilage. So that can be seen on both bones, this bone as well as this bone. They are going to get covered by a cartilage, that is articular cartilage. You can switch off your mic. Yep. And articular cartilage, as we discussed before, it works as a shock absorber and provides a slippery surface for the movements. That's a function of articular cartilage. This is articular cartilage. This one is articular cartilage. They are very close to each other in the joint, and it provides a slippery movement. It looks like an ice. Just imagine two ice cubes. They are moving on each other. How it looks. So it is something like that. Now coming to the next feature, fibrous capsule. Fibrous capsule, it is going to cover on the external aspect of the joint, which is going to give a lot of support. And it is going to be made of collagen fibers. Major content is collagen fiber. There are different types of fibers. We will see that in the next slides. There are collagen fibers, there are elastic fibers. So here it is lined by, or it is having collagen fiber in the fibrous capsule, and it is richly supplied by nerves. So there are a lot of nerves which are going to supply the fibrous capsule. So it is sensitive to pain. So you might have experienced, if an injury happens to the joint, it's a painful thing because the fibrous capsule is involved in those cases where it is supplied by a lot of nerves, and also blood vessels. The nerves, they can also pierce through the fibrous capsule and supply the inner aspect of the joint. Now coming to the synovial membrane. So I said before that synovial membrane is going to cover the inner aspect of the fibrous capsule. Fibrous capsule is also called as articular capsule. So it is going to line the fibrous capsule, and it provides lubrication. How it provides lubrication? Because the synovial membrane is going to produce synovial fluid, and which is going to line the synovial cavity, and it also provides nutrition to cartilage. So these are the cartilages. So cartilage needs nutrition, so that is provided by the synovial fluid. Now from where the synovial fluid is derived? Synovial fluid is derived from the blood vessels, or the blood vessels which are reaching here. blood is going to get uh, filled in this area in the blood vessels, because the joint is supplied by the blood vessels. Now from there, the synovial fluid is derived, and it is highly vascular. The membrane is highly vascular. It lines the inner aspect of the fibrous capsule, as we can see here, and also it is going to line the non-articular part of the bone. So here it is going to line the non-articular part of the bone. Non-articular part of the bone, in the sense, it is going to line the part of the bone where it is not going to form the joint. The part of the joint, the part of the bone which is going to form the joint is going to get covered by articular cartilage. So remember one thing: the synovial membrane is not going to line the articular cartilage. It ends here at the end of this. Now coming to the ligaments, we have already seen the ligaments, which are connective tissue. They're going to connect bone to bone, as we can see here. Anterior cruciate ligament, it is a ligament which is seen in the knee joint, ACL, and it is also called as articular larva or fibrous ligaments, other names of ligaments. Coming to the next structure, which you may see in a synovial joint: articular disc or menisci. So this can be seen in synovial joint, but it is not necessary that you always see articular disc in a synovial joint, but some of them has it. So what is it? So it is a cartilaginous disc. It's a cartilaginous disc, as we can see here, this one. So this is a bone called tibia, and this tibia here, and this is femur, tibia, and this is patella. All these three bones together forms a joint, that is knee joint. So here there's a sagittal section, and here we are seeing from superior aspect. So on the tibia there is a disc, and it is made of fibrocartilage. As I said, cartilage is of different types. We have hyaline cartilage, elastic cartilage, and fibrocartilage. So this is fibrocartilage, and disc is attached to the capsule at its periphery. So disc is going to get attached onto the periphery where the fibrous capsule is present. Now the major function of the disc is it is going to divide the joint cavity into two compartments. This can be seen very well here. This is a disc, this is another disc. So this is a cavity here. Now the cavity is getting divided into two parts: upper part, which is above the disc and the femur, and the next part, lower part, that is below the disc near to tibia. So these are two compartments. Now the single joint cavity is getting divided into two: upper compartment and lower compartment. That is because of the disc here, and it is not covered by synovial membrane. So synovial membrane is not going to cover this area, but it is present on the sides, as you can see here. Examples where you can see articular disc or the menisci are temporomandibular joint. It is shortly called TMJ, which represents the temporomandibular joint, sternoclavicular joint, and knee joint. In these joints, they are synovial joints, but they have a disc in it which divides the joint cavity into two compartments: upper compartment and lower compartment. The movements in these compartments, usually they are different. Anyway, we will explain all these things when we see these joints. Now, coming to classification of synovial joint. So synovial joint, we have seen it, synovial joint, how it is. Now we are going to divide or classify what are the different types of synovial joints. So there are two classification. The first one, according to number of bones forming the joint. So how many bones are going to form a joint? So based upon that, we have a division. The next one, according to axis of movements and shape of articular surfaces. Now on which axis, on how many axes it can move. So based upon that, the axis of the body. So based upon that, there is a division or types. And shape of articular surface. Articular surfaces are the surfaces where the two bones are coming in contact. So what is the shape of the articular surface? So based upon that, we are going to have the next classification. So according to number of bonds forming it, there are three: simple, compound, complex. Now, according to this criteria, that is the movements, the axis of the movements, and the shape of articular surfaces, we have uniaxial, biaxial, multiaxial, non-axial. So let's see. Uh, this is this can be explained in the next slides. Now, simple joints. In simple joints, only two bonds forming a joint. So it is, as the name suggests, this simple joint where two bonds are going to come in close contact with each other and they form a joint. For example, joints of fingers. Now, these are the joints of fingers. These are the phalanges which are forming the finger. Now, there are three phalanges: proximal, middle, and distal phalanx. Now, this joint, the joint between proximal and middle phalanx, this joint here, only two bonds are coming in contact with each other. Look at this joint. So middle phalanx and proximal phalanx, they are coming in contact with each other. So it is an example of simple joint. Now coming to compound joint. In compound joints, as the name suggests, there are more than two bonds. Now this is elbow joint. In elbow joint, there is humerus, which is a bone of arm, ulna, which is a medial bone of forearm, radius, which is a lateral bone of forearm. They are going to join here at elbow joint. So there are more than two bonds. This type of joints are called compound joints. Now coming to the last one, complex joint. So as the name suggests, it is complex. Here it is a synovial joint, as we know, and the joint cavity is divided into two compartments. Now the disc that we saw just now, the disc that is here and here, is going to divide the joint cavity into two compartments, upper and lower compartment. Now these type of joints are called complex joint. Example is knee joint. We just saw the knee joint. So knee joint is an example of complex joint because the disc which is here dividing the joint cavity into upper and lower compartments. Now coming to the next classification, this is according to axis of movements, and we are also going to see the articular surfaces, how the articular surfaces looks like. So based upon that, we are going to divide synovial joints into different types. So uniaxial. Now it's very simple. Uniaxial movement is possible only in one axis. So there are different axes in the body. So here the movements are going to be in a single axis. The first variety of it is hinge joint. This is a hinge which is attached to the door. You know how the door works or how the door can move. It can be opened or closed. That's the only movement. So here the movements are occurring in a single axis, opening and closing. That's it. So in the body, we have some of the joints which looks like this, which has a single axis. So here one surface can be convex and other can be concave. So here this is a convex surface, this is a concavity. This is a humerus and this is the ulna. So we are going to see that the elbow joint here as an example of hinge joint. So this is convex and this is concave surface. So here look at that, we are considering the joint surfaces, the articular surfaces. Now movements are happening in a single axis. You try to do movements in elbow, you can do only flexion and extension. So the movements are in a single axis. Another examples are elbow we already described, ankle, interphalangeal joints of fingers and toes. So this is regarding hinge joint. Remember, it is a uniaxial joint. Coming to the next, which is also a uniaxial joint, pivot joint. But here the movements are little different. Here the movements are rotatory movements. Now I will explain here how it is formed, pivot joint. So here, let's see here. So there is a rounded or pointed surface. So there's a pointed surface which is fitting into a ring. So this is a pointed surface and it is going to fit into a ring. It can be formed partly by bone and partly by ligament. Now here, this is an example here. There is a pointed surface. So here the pointed surface is this one, head of the radius, and uh, another area where it is forming a ring, a part of the ring. Now the ring here is this one, radial notch of ulna. So here you may not be very familiar with these bones, but try to understand that this is ulna, it's a bone of forearm, medial bone, and this is radius, which is a lateral bone of forearm. Now they are going to form a joint here, which is called as superior radio-ulnar joint. Now how it is formed? The superior radio-ulnar joint is formed by the head of the radius, which act as a rounded or pointed surface, pointed part, and the ring that is going to get formed by partly by the ulna that is here, and now there's a ligament which is going to cover this head of the radius, and that ligament is anyway annular ligament. I'm just naming it annular ligament. So there's a ligament and there's a part of the bone, and both of this is going to make a ring. Onto the ring, this pointed surface is attached. That is the head of radius, as you can see here. Now, somewhere here you have the ulna, part of the ulna, and this part is formed by a ligament, which is called annular ligament, and this is the radius. So now we can see a pointed surface which is rotating, which is going to rotate on a ring, and this ring is partly formed by the bone and the annular ligament. Annular ligament is not shown in the figure, but you have to imagine that. Here also we can see that this is a pointed surface of the bone. These are vertebrae. These are vertebrae. This is atlas. This is axis vertebra. Anyway, we will see about these things later. But try to understand that this is a pointed surface of the axis. This vertebra that is pointing just behind the atlas. And here, this is the pointed surface, and this is a ring. Here, look at the ring. It is partly formed by the bone, that is atlas, posterior surface of the atlas, and the ligament here. It is going to form both of this joint, and the ligament forms a ring. On the ring or in the ring, you can see the pointed surface, that is axis. So this type of joints are called as pivot joint. Here again, the movements are occurring in a single axis, that is vertical axis. So vertical axis. Now the axis can rotate. Axis can rotate. Similarly, here the head of the radius can rotate. Examples are superior radial joint and atlantoaxial joints. So this is atlas, this is axis. Coming to the biaxial joints. Now in biaxial joints, as the name suggests, bi means two. So movements on two axes is possible. The first type here is condylar joint. So condylar joint is a biaxial synovial joint. Now here, one bone has condyles. Here, this bone is a femur. It has got two condyles, which is convex, which is going to fit into a concave surface of the other bone. So here we are going to see the joint as knee joint, an example. So in condylar type of joint, as the name suggests, it has got two condyles, which is convex in shape and going to rest on concave surface, which is formed by the other bone. As you can see here, this is convex surface and this is concave surface of the other bone. And this can be called as a modified hinge joint. So it's a modified hinge joint. You know what is hinge joint? Here you have movements in a single axis, but here it is a modified hinge. So beside having movements in single axis, it has additional movement which can occur in the other axis. So totally you have got two axial movements. For example, if you come to knee joint, I said it is a condylar joint which has flexion and extension, and also there is a slight rotation. This can happen in a vertical axis. So altogether, if you see, the biaxial joint has two movements, or I can say movements occurs in two axes. In knee joint, it is flexion extension and rotation. A slight rotation is also possible. Now another joint which is also called a condylar joint, that is temporomandibular joint. Now coming to the next biaxial, that is ellipsoid joint. Ellipsoid joint, the articular surface is oval in shape. So here the articular surfaces are in shape, oval in shape. As you can see here, flexion and extension are possible. Now what we are showing here is a wrist joint as an example of ellipsoid joint, which is formed by the radius and the carpal bones. The movements are here, flexion, extension. So we are expecting one more axial movement here, that is abduction and adduction. Abduction and adduction occurs at anteroposterior axis, and circumduction is also possible here in this. So majorly the flexion, extension, abduction, adduction. Other example, metacarpophalangeal joint and metatarsophalangeal joints. You will better understand what are these things in a later slides or later classes. So this is the second variety of biaxial joint, ellipsoid. Coming to the next joint, that is saddle joint. In saddle joint, so you should know what is saddle. This is saddle. Now if you look at the saddle, there are two surfaces on the saddle. This is convex surface and this is concave surface. So in this joint also you will have two surfaces, a convex concave surface on one articular surface, and on the next articular surface you will see reciprocal surfaces. So flexion, extension is possible here, abduction, adduction also possible. Example here, scarpometacarpal joint of thumb. So here it's very clear that it has a convex surface, concave surface. Now here it has got this bond. It has got convex and concave surface. That's why I said reciprocal surfaces. But remember, one bond, the articular surface of the one bond will have two surfaces, convex and concave. Now the other bond will have reciprocal surfaces. So this is carpometacarpal joint of thumb. We are showing carpometacarpal joint of thumb. The other example is sternoclavicular joint. The next variety is multi-axial joint. So multi-axial joint, as the name suggests, here we have movements in different axes. Movements in different axes. The type is ball and socket joint. Ball and socket, as the name suggests, one surface becomes a ball and the other surface becomes a socket. This is an example here, hip joint and shoulder joint. Hip joint is formed between the femur and the hip bone. Now femur works like a ball, the head of the femur works like a ball, and this works like a hip bone, works like a socket. Similarly here, the humerus and the scapula, they form shoulder joint. Shoulder joint, the head of the humerus works like a ball, and the cavity which is formed by the scapula called glenoid cavity is going to work like a socket. So here the stability is not so great, but the movements are more. So you can see different types of movements. Just think about your shoulder joint. It can be moved like anything, right? You can move, you can have a flexion, extension, abduction, adduction, rotation, circumflexion. All type of movements are possible in this joints. This is regarding multi-axial. Coming to the next one, that is non-axial. Here you don't have an axis. In fact, the movements are very minimal, which are called as plane joint. Plane joints, they are very small joint where articulating surfaces, they are of plane articulating surfaces. So the two bonds, when they are approximating with each other to form a joint, their articulating surfaces are plane or almost flat. Examples here we are seeing intertarsal joint. So tarsal bonds are short bonds which are seen in the foot. So they are going to have joint between these tarsal bonds, which are called as intertarsal joints. So they are of plane type of joint. So these are the classifications of the synovial joint. Now nerve supply, as we saw before, They have sensory nerve supply, which takes sensation like pain and also proprioception. So proprioception is the sensation of the joint position or uh, joint sense. So on what state the joint is, whether it is relaxed, or the articular ligament, whether it is contracted, or whether it is flexed, extended, or the position of the joint can be known to the brain through these sensations. Anyway, other one is autonomic nerve supply. Autonomic nerve supply is sympathetic and parasympathetic nervous system, which supplies the blood vessels. So these are the sensory nerves, and articular cartilage is not supplied by nerves, hence insensitive to pain. So articular cartilage is insensitive, so because it is not having any nerve supply. Now there is a law which is related to the joint here, which is called Hilton's law, that says that a nerve supplying a joint also supplies muscles acting on the same joint and the skin over the same joint. So a nerve, if it is supplying a joint, that can supply the nearby muscles which are acting on the particular joint. For example, if shoulder joint, you see the shoulder joint. Suppose a nerve is supplying the shoulder joint, that nerve, the same nerve will supply the muscles which are acting on the shoulder joint, which can cause some movements on the shoulder joint, and also the skin over the shoulder joint. So that's called Hilton's law. Coming to blood supply, so there are a lot of blood vessels which are coming from nearby plexus. Plexus are the group of blood vessels which are nearby the joint, and articular blood vessels supply epiphysis. It can also supply epiphysis, synovial membrane, and articular capsule. And articular cartilage is an avascular structure, but it can get nourished by the neighboring blood vessels and also from the synovial fluid. I told you when I talk about synovial membrane and synovial joint that articular cartilage can get nutrition from the synovial fluid. So that's regarding this class.